Today, I'm excited to be joined by occupational therapist Sarah Brezkowitz, who brings expertise in the evolving world of artificial intelligence. So, we're going to dig into what AI means for rehab, exploring some of the latest research, and sharing practical takeaways you can use in your own practice. Welcome to Neuro Navigators, a MedBridge podcast where we conquer challenging topics in neurologic and geriatric rehabilitation. Our aim is to deliver actionable takeaways for physical and occupational therapy providers like you through captivating discussions with influential practitioners in our field. To receive continuing education credit for this episode and access bonus resources, make sure to check out medbridge.com. Hello, I'm your host, JJ Mauder-Tinney, a physical therapist with over 30 years of experience working with people with neurologic deficits, as well as the aging adult population. I have multiple certifications, including being a board-certified clinical specialist in neurologic physical therapy and a certified exercise expert for aging adults. Welcome, Sarah.
Thanks, JJ. I'm so happy to be here. So thank you for having me.
Appreciate your time. To kick things off, can you tell us a bit about your background and how you got involved in the world of AI and health technology?
Sure. So you already mentioned I'm an occupational therapist. I've been an OT for over 10 years. Most of my clinical experience comes from the neuro rehab world. So stroke and TBI were my bread and butter as a clinician. But I segued into health technology in 2022 because I was just looking for a new path to expand my passions and to kind of use those creative problem solving skills that we as clinicians come with. So I started at Sensi AI, which is a startup that's focusing on using ambient AI technology for remote patient monitoring, really supporting older adults aging in place.
Oh,
And
cool.
I was able to manage a clinical team, really help the product and engineers identify clinical insights that we can share with care teams who are working with older adults. I then moved on to Ambience Healthcare, which is where I'm at today. And I'm a clinical impact specialist, and we're using ambient AI technology for medical documentation. So that's AI scribing as well as clinical decision support. And I'm helping physicians, advanced care practitioners use this technology to support their clinical workflows.
Now, a clinical impact specialist. I love that. That is super cool. And I just think this AI, I'm way into this. I just think there's so much potential. So I'm so excited about our talk today. So, why do you think it's important for us to be talking about AI in clinical practice right now?
Yeah. That's a really great question. And it all comes down to it's important that we talk about it because it is entering healthcare. It is entering our clinical practice, whether we're ready for it or not. So, if we're really going to be at the forefront of this technology and really using it in an impactful and powerful way, we need to be familiar with it. So, I think of AI as this amazing tool that's going to allow us to extend our reach of our services, support ourselves as clinicians as we have more and more demands placed on us with what we do, but really also equip our patients to be successful when they leave our care and help set them up for the paths at home in implementing the things that they learn through us. So there's a lot of different use cases for AI that I think are really going to support the whole clinical pipeline.
Well, and I think that's such a great point. I mean, I think about the therapists and how can we help them so it's not so stressful, and then think about the patients and how can we get better carryover. I don't know. I don't know how those things will work. That's why I'm excited to hear some ideas. But the tech is going. It's just moving so quickly. So this is evolving. I mean, I don't know what should we be thinking about or even rethinking when we talk about our roles as a therapist to start with.
Yeah, it really starts with some self reflection. So, thinking about what outstanding needs or gaps do I currently see in my practice or for the client that I'm serving or even within my organization. And then from that needs assessment, essentially identifying what can AI support me with in bridging that gap or meeting that need. From there, you can start to think about how could I then use a tool like that responsibly? How can I ensure that it's going to deliver on whatever I'm setting out to use it for? And then the final thing I think it all comes down to is at the end of the day, everything we do, whether it's for our personal efficiency or delivering interventions more effectively, the patient is the one that needs to benefit at the end of the day. So anything that you're choosing to incorporate into your practice needs to also benefit the patient in some way.
I like what you're saying about the needs, looking at the gap. I always think of that more as, what are my needs? Is what makes me crazy? What do I get frustrated doing? Like, is there some other thing that could take care of the frustration? I always think about the therapists complain mostly about documentation and that time because that takes away from the patient. And so if there's ways of thinking about what is frustrating you the most and just seeing, like you said, assess, is there a good way to take care of those? I don't know. That's just how I think of it when I think about a gap from a frustration standpoint. And I think that just looking at those roles, I mean, it's still so new. So I get excited about it, but I also know there isn't, because it's so new, there's not a lot of research, right? So, I mean, I would think, especially in regards to healthcare, but I don't know that. So, do you have any highlights or any key things to take away from what you know from the research?
Yeah. You're right that research is still emerging when it comes to artificial intelligence, but that doesn't mean that there isn't something out there that we can start readily diving into and looking into. So, when I look at specifically to the rehab space, OT, PT, speech, we do see that there is value in implementing AI in those spaces to help in the different ways that I just mentioned. I think a core concern or a theme that comes from that research is that clinicians are worried that this is going to replace what we do and take away our role in healthcare. And what you'll see as you dive further into that is the way that AI is being positioned in healthcare is not to replace what we do, but really to augment and enhance how we do what we do. So it's there to complement our practice. There are also studies that show how AI can support that clinical decision making process, both by helping to personalize treatment plans, free us from some of that administrative load that we have. So it's very promising in neuro rehab to help us with that clinical process of tracking progress with our patients, identifying issues that maybe are more nuanced than what we're readily able to achieve on our own in the time that we have for like a standard evaluation, as well as help us with predicting some recovery outcomes. And then the final thing I'll mention is that ethical use of AI is always top of mind. And there is a lot of evidence out there that stresses how to use AI in an appropriate way where it comes to mitigating bias, maintaining transparency, and maintaining patient privacy as well. So there's research out there that I think clinicians can dive into right now, as well as understand that it's just going to continue coming as more and more people use it in practice.
Okay, so there was a lot in there. I'm really interested in trying to highlight. And know we're going to continue to highlight specifics. I was just thinking the last thing that you said. I was just thinking about teach since I teach. Making sure we're teaching students. Where do we start with teaching students about AI and that the ethical component, and then the HIPAA and making sure we're not using patients' names and those types of components. So I I I was just thinking that's gonna be an interesting. I know that's just starting to come up, to the surface. Now, the other components that you added, you talked about administrative load. So, I look forward to talking about that, and then the decision making, and then personalizing exercise programs, and following up with patients. So there's a lot of pieces here that we can talk about, right? So building on that and that list, looking at some specific solutions. I'm very so you can tell I'm very fascinated with kind of going through these kind of step by step to see what kind of clinician solutions for clinicians, because I think we have a whole variety of people listening in the audience, from OTs to PTs to speech, and I'm hoping that from this, like going through some of these options, since I'm talking to the expert here, they will all have something that maybe that will resonate with them.
Yeah, I definitely hope so. And like you said, there's so much to unpack. And so that's why what makes the most sense for my brain is bucketing it into what's going to help the clinician, what's going to help our process, and what's going to help our client at the end of the day. And I think that that's a really great way to frame a lot of that.
That's what I was looking for. Okay, so what would help the process?
The clinician first. Yes.
Clinician first. I like that. Clinician, the patient, and the process.
Yep.
Okay. Okay, hit me with it. You start wherever you like.
All right. Well, let's start with the clinician because it's no secret that we're asked to do more with less time. And I think that that's what leads to a lot of burnout clinically today. So when you're looking at what's going to help me as a clinician, I think of administrative tasks, whether that be documentation, scheduling, billing, depending again on what kind of setting that you're working in. The documentation side is something that I'm well versed in because that's the space I'm working in today. And you can think of how natural language processing, which is a part of a lot of these ambient AI platforms, is really going to help increase the speed and specificity of documentation by automating that transcription process. So if you're having a conversation with your patient or going through a session, having an AI tool in the background that can capture that content and then transform that into your medical note or your clinical note is really going to streamline your process. You don't have to then wait for the end of the day to type everything up. The platform's kind of doing it for you.
What,
Similar, yeah,
so sorry. So
Mhm.
natural language processing.
Processing. Yes.
That's just all that means, what you just said?
Yes, exactly. That natural language processing, you can see it in a few different ways, but essentially analyzing what's spoken or what you might type into something and analyzing that language, our English language or whatever language it's set to analyze, to then transform that into whatever you need that output to be. So it could be medical documentation, clinical documentation. It could be you describing, I would like an image that reflects X, Y, or Z. And it would take what you describe and then transform that into the image that you need.
I just have to tell you that I was recently went to my doctor, and she's very, very busy, and she's very thorough. So she spends a lot of time with you. And she was so excited. She came in with her phone and said, I have this new thing and I'm going to record it if it's okay with you because it's going to write my note for me. And I was like, you aren't doing this already? Like, you need to be doing this. So she was very, very excited. So she let me help her. And then afterwards, it did a great job. So it was really impressive.
Yeah. Also, think about things like professional development. Um, Having a tool that can streamline the knowledge for you if you're trying to maybe do a literature review and having an opportunity for a tool to consolidate the information for you. Maybe you want to do a research project and you want ideas to help draft your hypothesis. Um, there are different ways that AI can support that process while you will still be in charge of, again, the directive and ensuring that the content that you're getting at the end of the day is valid and for your needs. AI doing the heavy lifting of providing suggestions to you can just reduce a lot of that time that you'd spend on that end. I even think of, if you're doing a virtual CEU, for example, could you have a AI tool running in the background that's taking notes for you so that you can actually sit and listen to the content from that platform and not need to be feverishly trying to write down every sentence that you hear. So that's another way that it can help the clinician.
And it can listen to that CEU and then
Mhm.
like summarize the big takeaway points for you.
Exactly.
Is
Yes.
that how that works? I haven't
Yeah.
used that. I've heard people using that before, and I never even thought of it. So
Yeah.
that's a great example, especially when you're at a conference where you're going from like our combined section meetings or like the AOTA's conference where you're going from one to another to another.
Yeah, I think that's a really great example. I just went to a conference where by the time I got to the last, presentation, my brain's a little fried in terms of being
Right?
able to like fully attend. So having that kind of safety net or that assist again will allow you to be able to have a very easy way to review that content.
That's outstanding. So great backup.
Yeah.
And you were talking about research as well?
Yeah, research, like I mentioned, whether it's consolidating information from like a literature review or synthesizing evidence. If there's a topic of interest, using an AI tool where you can, try to have it source articles for you. So maybe use that as a first step for where you might want to dive in and look more. If you're interested in the topic of AI, finding one of those generative AI tools where you could, again, type in the topic and have it present to you a place where you can start, so that the internet, is so vast and large, it can be kind of like a rabbit hole of information. It's a great way for synthesizing information.
Well, and I think you brought up a great point. Like, some fears are replacing us, but this is just going to let us potentially like excel, right? Because we're not spending time on, not that it's not important, busy work of searching to be able to find that. I think that's
Hmm.
fascinating.
Yeah.
All about time.
It is about time, and we never have enough of it.
And that goes directly into delivery of care, right? So, um, how do you see, can you give some examples of AI enhancing our assessment to treatment planning, directly the clinician?
Yeah, there are a lot of products coming on the market that use video capture sensors to help detect different patterns of movement. Get to those person-centric factors that I think we are able to do ourselves, but maybe not to that level of granularity as having that other tool to assist us. So, AI is very much a part of the diagnostic and assessment process. Beyond just us as clinicians, the medical world has been using that to review imaging and things of that nature for a long time. So it's great that we're now seeing that come into the rehab space too.
So that everybody can use it. I mean, you're right. We've had movement analysis done before, but it's usually in big labs and
Hmm.
need all this expensive equipment. And now, if any clinician can kind of access that and be able to show a patient, I mean, I just think that's super exciting because then it can help you really narrow down where you want to focus.
Yeah. And to that point, they're leveraging existing technology, a lot of these products, using phone applications or like an iPad, something that is now more standard in a lot of clinical spaces. Even, patients have those as well, to be able to leverage that video capture technology for a similar function. Or if it's a sensor, connecting that to an application that, again, a person can have more accessibility to.
Well, and you can use, I was just thinking, really be able to see improvement, to see if your interventions are making a change and be more objective, maybe even to justify to insurance. I don't know. That seems like it has potential there too.
Yeah. Well, and that's also kind of leads into what you were just saying with the personalized treatment plans. Being able to get more data or information that's specific to the individual is going to allow you to be more tailored and adapt your treatment plan in that way, which is going to lead to better outcomes, because we know the more person forward we can be with what we do, the better they're going to succeed at the end of the day. And so it kind of all connects to this pipeline of what we're doing for the individual, how that then feeds into reimbursement and outcomes. It all kind of works in harmony that way. So AI is all about data. It operates by what it can review and analyze the data coming in to then give you that high quality output. And that's what's going to help with personalizing those treatment plans.
Okay, that's exciting because, what we generally hear and what's happening is we have less and less time with complex neurologic patients, both PT and OT and speech. And so all three of us have less time with our patients. And so we don't have a lot of control over some of those pieces, but we do have control over our session. And so, something like that, that gives us even more control to be able to do something better, quicker, faster,
Mhm.
potentially in regards to reaching outcomes, just seems like, you know, definitely worth looking into and understanding better, as opposed to, I can understand the fear, but this isn't going anywhere but more, I would think, right?
But even more, and I would say more in the sense of even beyond just the session itself, because now with AI, when you think about how it's being applied to things like remote monitoring and telehealth, that's taking us outside the clinic or outside the treatment session now, giving an opportunity for us to see trends and patterns and person's behavior, or follow up on an exercise program that you maybe gave them in their home environment, their naturally occurring space, so that you can get more visibility into that progress, and essentially allows that session. If you're a home health clinician, you only have so many visits that you can do. How awesome would it be to get information about how your client is doing outside of those visits, so that when you are with them, your time is even more maximized? I think that's wonderful. And, having seen this technology in action in the home setting where you can get things like trends on a person's respiratory patterns or see where they're maybe more prone to having falls. It's that kind of information that I think is going to help your complex, acute individuals who are getting pushed home sooner, as well as our older adults who have chronic conditions that they're living with and being able to support them for the long term.
And it is exciting because when you look at it, at least in the neuro world, the neuro trend is that we're finding really great interventions for clinic time, but we're not seeing it always carrying over to their performance, to their participation in the world. We're not seeing that carryover. So there's a bridge that we need to, or there's a gap we need to bridge. And so just thinking back to your gap, that could be our bridge that may be able to help us once we figure out some different strategies and look into it, the best way to be able to really support people at home and finally figure out how to help with the performance from
Mhm.
those pieces. So wow, that's really exciting. So I see that from an aspect of um, you talked about diagnostic tools, personalized treatment plans, right? Remote
Mhm.
monitoring, which makes me very excited. You had another one though, right? Didn't you?
Oh, the predictive analytics, like that pattern recognition piece, that's kind of layered over all of that. So, the whole part of having this data is to not be able to just look at one moment in time, but to see progression over time and start to use that information as well as maybe historical data to predict where's this person heading next. So, based on what we see they're doing, are we on track for those goals that we set? Or maybe do we need to think about a different approach to get them where they need to be? I think with AI being able to process large volumes of data and potentially even compare that to what are other people with similar strokes, also, doing and progressing with, that's what's going to help us be even more impactful in that recovery process.
Yeah, I think about when I was in acute inpatient rehab working and, you had the FIM score and, you did the ASIA testing for your patients with spinal cord injury. And that was to be able to compare, progression and, which ones got better and which ones,
Mhm.
and comparing interventions. And you had that data, but to be able to do mass amounts of data processing and analysis is just a tremendous amount of work. And it just seems like from this standpoint, to have the ability to take large amounts of data and really break it down and ask the right questions, that the amount of information that could be gathered, especially now that people are more consistently using outcome measures from CPGs. And if we were to stick to similar outcome measures, the comparisons we make, it seems like there's just like so much potential.
I 100% agree.
Yeah, that's really exciting. So, what about more from an intervention standpoint? Are there tools that can help us, like in session, or I mean, we talked about some carryover, but
Mhm.
those types of things?
Yeah, there's quite a bit available. The first thing I kind of have on my list is smart assisted devices and voice assistants. These are things that have kind of been a part of the conversation for a long time. Um, and what is a great, I don't think people often think about how there's AI operating in the background of those, but often those are used to enhance the engagement with the environment. So if a person can use their voice to activate certain elements in their home, or maybe to use it to set reminders if they have some cognitive difficulties, that's a really great way to leverage kind of that virtual chat, so to speak, to help individuals be more adaptive in their environment.
Yeah, and that can range a whole variety of diagnoses. I was just thinking from,
Mhm.
your
Yeah.
patients with high level spinal cord injury to, also just from the standpoint of, with speech, PT and OT working together, we
Mhm.
can really determine what are the priority pieces that could be set up to work with that.
I have a really quick example that someone uh, told me recently that just kind of blew my mind. But they had a loved one with dementia who was asking their spouse over and over again similar questions and kind of burning out the spouse from having to respond and provide that. And one way that they allowed the individual to be more independent in that question and answer was to leverage the voice assistant they had in their home. Asking that voice assistant the question and getting a quick response was one way to mitigate caregiver burnout, but also allow the individual to have the autonomy to be able to ask and engage in some of those simple questions. What's the weather? What's today's date? Things like orient themselves independently by using a virtual voice assistant.
Wow, I would have never thought of that.
Yeah.
That's a great idea. There's just so much potential, and I don't know if this is the right place, but what about from the therapist perspective if there were issues with a language barrier or
Mhm.
trying to improve communication? Is that any way that could be used for that?
I think that kind of falls into the bucket of that responsible and ethical use of AI. So I think it's definitely something when you're looking at what do I want to use in my practice, what is the needs of the population that I'm serving or the individual that I'm serving.
Mhm.
And if one of those needs is well their English is not their native language, then sourcing a tool that does have more multilingual support is going to be important. And if it's something that you're bringing into practice for truly like more of a population level use, um, talking with the vendors or those that are behind the product to see, do you support multiple languages? Is that in your plan to soon incorporate multiple languages so that then you kind of have knowledge of, is this going to be the right fit for me?
Oh, great questions. That's great. I know that was just a sidebar because it just
No,
popped
yeah.
into my head, but that's great information for therapists and for people who are administrators who are asking to make sure we're asking the right questions because
Mhm.
I don't even think we know what questions to ask. So
Yeah.
that's interesting. Okay, so I know you've got more. So what else do you have?
Yes. The next few things that I'm going to talk about are also things that have been around for a while. But again, I don't know if we're thinking about how AI being a part of that process is just going to level those things up. So, virtual and augmented
Mm,
reality, that's been
yes.
around for a while. But again, thinking about how with AI it can make those immersive environments even more contextualized and more conducive to the rehabilitation needs that we have when it comes to robotics and prosthetics and exoskeletons. AI is going to help fine tune how those operate to be more specific to the individual, more readily able to process their individual movements and use those. Learning algorithms to make predictions and help further improve their progress. And similarly with wearable sensors, that just allows for more real time monitoring and tracking, which further just helps you in that moment get more data, more information about the person beyond what you could probably readily see with the naked eye. So I think that having AI applied to that again takes things that we are already using and seeing in practice, but just provides information back to us as a clinician at a deeper level so that we can have a faster turnaround and impact.
Yeah, especially if you think about the research on virtual reality and the evidence that supports how beneficial that can be and the augmented. And then I think about some of the things you see, like they can, just make lots of things real that aren't real.
Yeah.
And so just on little programs on the computer, I'm just always amazed. I'm like, "Oh my gosh, like how did you get that baby to say those lines?" And they have that
Yeah.
whole augmented part. I'm just thinking if you were able to get their house set up or
Mhm.
you could have them really inside their household
Yeah.
potentially.
Even with something as simple as like a wheelchair, which, is been around for so long and I would say is due to level up, people are using AI to take it to the next level. There is research being done on autonomous wheelchairs, which would open up a whole new world for individuals that can't use a wheelchair in its traditional state. Additionally, I was at a conference and a individual was talking about how they're seeing now there being sensors that can be attached to wheelchairs that are using AI to help provide feedback to the user on barriers and things that might be obstructing their path. So it's really cool to see that technology be applied to very fundamental pieces of equipment that we see in practice.
I was at an airport. I don't know if you know which airport this is. I can't remember now where I was, where they have the automatic wheelchair that goes to the
Yes.
gate and gets the person and takes them to the other gate without people.
My dad sent me a video of one. He was at an airport in Florida and he's like, check this out. I was like, that's so cool. So see, like it's out there already.
Yeah, I
Yeah.
should have videoed it. I can't believe I didn't do that because I think I was just in shock. I was like, "What's happening right now? Like,
Yeah.
what is happening?" As it was going down, and then
Mhm.
it turned into a gate, and I was like, oh my gosh, I couldn't believe it. So yeah,
Yeah.
it's just amazing to me. All right.
My My
Keep going.
final group of items kind of falls into the bucket of the non, like, motor, I guess, specific, realm that I think we often lean to when we think of rehab. So kind of expanding into, like, vision and cognitive rehab. Um, AI enhanced eye tracking software could better help with training and assessing visual skills and processing needs. You could also think of, magnification tools that are out there. There's some applications that will do text to speech conversion, or if you take a picture of an image, it will then relay auditorily what it is that person is looking at. So with someone with low vision, can have more accessibility to the world around them. Similarly, with cognitive rehab, being able to adjust the way a person consumes information to better suit their processing style. So think about if you had an individual who wants to get back into reading or is having difficulty with processing written information. Could you use AI to maybe rephrase or reformulate how that information is presented to be more easily digestible by them? That's just a couple ways I think of AI being able to support that cognitive process. And it's all kind of interwoven, right? Because when I was talking about the virtual voice assistant, that could also be used as a cognitive tool to set reminders and kind of help with memory aids. So it's not just one thing. I think any one tool can kind of touch on a number of different skill sets.
And speech therapies, the speech therapist must be in heaven right now. I would think just that there just seems to be like a lot of potential in regards to AI for them. Would you agree with
Mhm.
that?
I would agree with that. And, think often back to my inpatient rehab days when we would have speech therapists creating communication books for patients and trying to source
Yeah.
content that was specific to them. With the way that now generative AI can create images and you can get an image to be as detailed as you need it to be, that's going to open up a whole new door for personalization. I've even seen augmented communication devices where the individual can kind of go through that process of selecting what images do I want that best reflect myself, or helping to improve, speech deficits through giving the individual real-time feedback about auditory quality or the clarity with which they speak. So I think there's a lot of great options for speech language pathologists too.
And on that, they figure that out, or but then to communicate it with the rest of the team, like
Mhm.
there's, it's going to be easier to communicate with the rest of the team and the family so that we could all be more consistent. I think because again, you'll kind of have a system in place and a structure, and it'll be very specific, and then I just think that's easier from a team perspective to reinforce. That's
Yeah,
exciting.
consistency is so key, both interdisciplinary, but like you said, between the patient and their caregiver, the whole community that's kind of working with that individual is really important. So having information that can be leveraged at multiple stages of the pipeline by different stakeholders, I think is one key way that AI really can help cover that whole care continuum.
That's so exciting.
Yeah. And finally, I don't think I mentioned mental and emotional health support, but it kind of reminds me a little bit of when we were talking about research, like synthesizing information. So there's a lot of applications coming on for caregivers as well as patients and clients to help them get the right strategies or support they need at just the right time to again empower them to address any psychosocial needs that they might have, to maybe track mood and learn more about their emotional regulation patterns. So there's a lot of tools out there on the emotional and the mental health side as well.
I find this all so incredibly helpful because I think if, I mean, this is opening, I mean, I'm trying to pay attention to this because I just find it fascinating, but this just opens your eyes to all of the potential. And then I think it's easier to, accept it or to know what questions to ask or, those types of things. So I just love this so much. And just looking at this, if you're talking about the therapist, aiming for maximum impact. This is our thing. We like to say what are the top three actionable takeaways for clinicians. I think, I'm really, really interested in what you would say the answer to that question specifically.
We've talked a lot about my first point, starting with the needs assessment. I think oftentimes people see shiny new tool or application and they're like, how can I use that? Where really we need to think of the reverse. What do I actually need? And then let that guide you through your search process. So I know in today's conversation, we kind of kept it high level in terms of how AI can be leveraged, but really it's important to know the how so that when you look at your needs, you can then go into your search with more focus. I know that AI can be used in X, Y, and Z ways. I know that there's a gap in my practice in this respect. Now let me go into my search looking for what's going to match that and bridge that gap like we talked about.
Oh,
And
wait, can you just sorry, can you just say that one more time? Because that was just perfect. You ask for this, you tell them this,
Mhm.
you tell them this. Say it again.
I know the how that AI can be used and I know what my need is. And so now when I go into my search, I'm going to look for what kind of tool will bridge that gap, take the how and the need and bring it together.
Okay, thank you.
Yeah. And then with that, you have to stay like open-minded and critically curious, I like to say. And that's why, again, if you don't start with the tech, because that's going to pigeonhole you, but instead stay critically curious about when you're looking at how am I going to bridge that gap, what is out there that's accessible to me, and then going through some deep questions of what are the specific needs of not just my process but my patients. I practice in a rural setting with maybe patients that are in this type of population, whether it be diagnosis, age, maybe, if they speak another language. Those are the type of things that you'll want to look through and ask questions about to make sure that whatever you're going to bring in is going to actually align with what your need is.
I love that critically curious,
Curious, yes.
right? Because I just think that, and then to know that you just keep asking questions and to be more specific, more specific with what your needs are,
Mhm.
and you have to draw a picture. You can't just ask a general question if
Right.
you're searching,
And
right?
you can't be afraid to ask a question. I think sometimes when I'm talking to clinicians, they're like, "Well, I don't know if I can ask this." Ask it. There is no question too big or too small. And if you feel like it's a tough question, then all the more reason to ask that question. And if you're talking to a vendor of a specific product and, you want to know, how are you HIPAA compliant, for example? If they can't answer that in a satisfactory way, then you have your answer as to whether that's the right tool for you or not. So you're only going to know through asking questions.
Yeah, that's great. Great advice.
Yeah. And then finally, collaborate with others. So this isn't something that you have to go through on your own, whether you're in a private practice, whether you work with a large health system, whether you're in a teaching or research institution. Pull in other colleagues with you because chances are, if you're interested in something like that, someone else is too. And you might even find that you have individuals within your network that have done some of this and have already gone through parts of the process. It can maybe add more insight to you to your next steps than you thought before. So don't hesitate to bring in others as you go through this critical evaluation process.
Outstanding. Okay, I love those. I think those are three really important components. And it helps kind of set the stage. So I know that you have some hypothetical case examples that you can give us because I think that would be really helpful in kind of pulling everything together.
Yeah. So, like I said, if we're talking about the how in this first example is using AI that's analyzing movement through computer vision. And the need here is targeting, have the more specificity to target upper extremity engagement, fine motor engagement. So imagine you're an OT, you're in a pediatric outpatient clinic, and you have a tool that's using a smartphone with an AI program that has a game that you're going to use as a preparatory activity to target those motor movements. And the app in this case is using that computer vision to analyze movement quality, identify asymmetries in real time, and give you and the patient instant feedback on their movement quality and form. And so with that, you're able to get more objective information, not just from what you see with your naked eye, but also what you're gaining from the analysis with that program to then um, better fine tune what your next steps are in your intervention process. As you do your outcome measures, you can use that metric in addition to the data you gain from the application to further inform your decision making and how that person's progressing towards their goals. And the great thing about an application like this is the child can actually continue to do that preparatory game at home. So you can load that app on the parent's phone. When the child's at home outside of visits, they can continue to engage with that game that's also working on the motor movements that you need them to be practicing. So maybe that's part of their home exercise program, and the child's more likely to engage in that because it's fun and it's more designed for what they want to do. That's a case for a child, but I would say even for an adult, there are similar tools out there I've seen using virtual reality and gaming functions to also engage in those motor movements and be used in clinic and outside the clinic.
And I would say that gamification kind of component is so beneficial, and that external focus. And then not just for the therapist to see, okay, are we showing improvement and how do they look, but for the patient or the child to get a better time this time
Mhm.
or to beat their score from last time. And so that whole, active knowledge of results can be so beneficial as well. So I can see it being used on multiple levels.
Yeah, I think the great thing about that medium is that it has goals kind of baked within it. We set our rehab goals. The client has goals that they want to return to, but then as they're engaging in the activity, there's many goals of, like you said, I want to beat that time, or I'm going to use my right arm more because I want to get a certain percentage or whatever
Right.
benchmark I'm trying to hit. Yeah.
Very
Ano-
exciting.
Another example I was thinking of was for our speech language pathologists out there. So imagine again, your how is you're going to use AI voice assisted tool because your need is you want to further help clients who maybe have stuttering or speech impediments to improve their vocal quality. So in this case, a speech language pathologist working with clients who stutter incorporates an AI driven application that's using speech recognition to provide that instant feedback, both on fluency and help them have exercises they can continue practicing at home. So it's a phone application, like I said, that can stay in the clinic and also go with the person outside of that clinic. And it can help track progress over time. So the speech therapist can see how well are we getting that clarity and improving when we're in clinic, when it's you and me, and how well is this translating in the real world when you're not with me. And again, that data can help inform what's the next step in our treatment plan. If it's doing great in clinic but we're not seeing the same carryover at home, what can we maybe adjust to further help you in that natural setting?
And again, I know I said this before, but I just think, and if that's able to go with them, then it can go with them to PT and it can go with them
Hmm.
to OT and it can
Hmm.
go with them to the doctor. Because if they can't communicate, if they're challenged communicating to the doctor, once you see the doctor, that makes you nervous and that
Hmm.
could cause even more difficulties. But if they have a strategy they could incorporate that's portable, that then the doctor could even see. I don't know.
Yeah.
I love this idea of something that could really benefit the patient, but that everyone could be a part of so that the communication and the collaboration, as you were talking about collaboration, would extend and it would just teach us all so much, I think.
And my favorite part of it, honestly, is the feedback that the individual gets for themselves. Because I know something that I really tried to do as a clinician in patient rehab was impart as much knowledge as I could to the individual so that when they left my care, they felt empowered to be able to check themselves on, am I doing things the way I want to, or am I carrying things over? And so I think having something that doesn't require you to have another body to give you that feedback, but allows you to get that feedback and ingest it and understand it on your own, I think is really powerful.
And think of that. I was just thinking like if you're fearful or if you're scared of trying some doing it wrong,
Mhm.
you don't want to involve your family, am I doing this wrong? Like, who wants to ask that? But to ask, something, you have something that can tell you if you're doing it right. So then you can be reinforcing, and you'd want to reinforce that even more, but you don't
Mhm.
want to if you're afraid you're not doing it correctly. I didn't even think of that. That's a
Mhm.
great idea.
Yeah.
Okay, so you brought up some great examples of just being able to do that from all disciplines. You brought up, and again, I love that needs assessment, not the tech. I'm repeating that because I represent that remark because it's shiny. And so then I forget what am I trying to use this for? So I just think, and if we pay attention to what we feel like we need, just pushing people to feel comfortable and asking, right? Just keep asking, because it sounds like, given all the different examples you gave, there's lots and lots of different options. So this is just so incredibly helpful. Now, I know to kind of wrap up a little bit here, we had asked you if there's a question that you wish I would have asked, which is like one of my new favorite things. And you said, what's the most unusual or creative adaptation you've seen in therapy? Is that you were hoping that we would ask you. So
Yeah.
I can't wait.
Oh, this actually has nothing to do with technology either. It was just in thinking about when I think back of my clinical practice, when I was working directly with patients, what's a lasting impression in terms of someone being super creative and adaptive with their day to day. And I was working with a young woman who had severe dyskinesia from recurrent brain tumor resections. I mean, literally, she could not stand, or else her body would be flailing all over the place. So she actually functioned at floor level when she wasn't in her power wheelchair. And together we had to reimagine her daily routine, like bathing and dressing, working. She loved to dance. So, how does one do all of those things from a floor level to maintain safety and allow her to be the most independent as possible? So, she taught me so many things about how to redefine what is quote unquote normal, or what is quote unquote a successful way to do things, through just thinking about everything I knew about getting dressed and adaptations and creative ways to do that by doing that on the floor and staying grounded. So I just couldn't think of like a more like out of the box way to live. And that was really something I'll carry with me forever.
Oh, I really appreciate you sharing that with us. That's wonderful. Oh, I love that. So, well, that's all the time we have, though, for today. So, huge thanks to you, Sarah, for sharing such thoughtful insight and real world takeaways on AI in rehab. I have a feeling this won't be our last conversation on this topic, though. So, stay tuned.
Yeah, just about everything we talked about could probably be its own episode altogether. So I appreciate you, JJ, for having me and for tackling the topic of AI and really hopefully opening up the audience's mind to what it is and how it can be used. I'm really glad we had this conversation.
Yeah, I appreciate your expertise because this is going to continue to change and evolve. So, I look forward to keeping in touch. Thank you.
Thank you.
Thank you for tuning in to this episode of Neuro Navigators by MedBridge. Please be sure to subscribe and listen to more of our episodes on Spotify or your favorite podcast platform and at medbridge.com. If you're listening outside of the MedBridge catalog and would like to access the bonus resources and receive continuing education credit, simply log into your MedBridge account and search for this episode to find the accreditation details. Neuro Navigators also listens to you. If there's a particular clinician that you'd like to hear from, or if you have a clinical question or challenge that you'd like to see addressed on this podcast, please let us know by leaving a comment on our Instagram posts or by emailing podcasts@medbridge.com. As we wrap up today, remember that your dedication makes a difference. We appreciate you being here to navigate these topics and hope you enjoyed our deep dive into everything neuro. See you next time.